What is up, guys? Welcome back to the channel. Today we're going to be talking about how to get rid of bad breath. So a lot of my patients have been asking me for solutions for bad breath or halitosis, and I figured that it's about the right time to make a video on it. First, we're going to talk about what causes bad breath. Next, we'll look at some conditions that make it worse. And finally, we'll talk about some at-home treatments that you can do right now. So what causes bad breath? The primary cause of that odor is bacteria. And this bacteria can be found all throughout the mouth, along our gum line, in between our teeth, and even on our tongue. And as this bacteria breaks down food, it releases a sulfur-like odor that we associate with stinky breath. Now, there are a variety of solutions that will help you reduce the amount of bacteria in your mouth, and I'll talk about that later on in the video. But before we do that, let's talk about 4 main factors that contribute to bad breath. Dry mouth is one of the biggest contributing factors, and it's associated with a reduction in saliva. And what a lot of people don't realize is that saliva is super important because it cleanses all that bacteria that sits along your gum line throughout the day. It also has a lot of amazing properties that help you prevent cavity formation, and it helps with the breakdown of food in the mouth. Unfortunately, this flow of saliva can be reduced in a variety of ways. For example, chemotherapy medications have side effects that reduce the salivary flow in your mouth. This means that these type of patients will have a higher incidence of cavities at their periodic examination appointment, and they're more likely to develop bad breath as well. This is why these patients have to be extra careful taking care of their teeth, because they're at a higher risk of developing these big cavities. Smoking tobacco is another huge factor that can lead to bad breath. Smoking in general doesn't really have a pleasant odor to it, but also smoking can contribute to periodontal disease, which is associated with a variety of bacteria and can lead to that really bad odor coming out of your mouth. And we should also mention that there are some studies that associate mouth breathing with halitosis.
Mouth breather.
There are claims that mouth breathing can have a negative impact on the saliva, and this is why it would lead to bad breath. Another huge contributing factor is your diet. I think we all know that foods like garlic and onion can produce a really bad odor in your mouth. Once you eat these types of smelly foods, the chemicals that cause the odor get absorbed into your bloodstream, eventually transferred into your lungs, and then exhaled into the air. So I really shouldn't have to tell you this, but if you're trying to have fresh breath, stay away from stinky food. Low carbohydrate diets high in protein have also been found to be associated with bad breath. This is found in people that are doing, let's say, a keto diet, where their body is digesting a lot of the fats, and then the ketones are released into the air. It's not really that big of a problem, but I would recommend drinking a lot of water throughout the day if you're on this type of diet, so that you can flush the ketones out of your system. Now, I've talked about periodontal disease in a previous video, but I didn't really mention that the bacteria associated with the periodontal disease can produce an odor that is noticeable to people in a room. Large cavities can also produce this type of odor if it's housing decaying food or bacteria that isn't properly cleaned out. So it goes without saying to go to your local dentist, someone you trust, get your examination done, clean out any cavities that need to be cleaned out, get a good cleaning in there, so that you can be on the road to health. And in this category, I should also mention that if you recently had an extraction, a tooth pulled out of your mouth, you want to keep that extraction socket clean, because sometimes that extraction socket can carry food that's decaying, and that can cause bad breath too. So you don't want to pick around at it too much, because you want that blood clot to stay in there. But if food gets in there, or if it needs to be cleaned out, make sure you're irrigating with the proper solution. And finally, health conditions is the last major contributing factor to halitosis. If you develop postnasal drip, for example, you can imagine all all that mucus is a reservoir for bacteria, and this can also trigger bad breath. Some people have really bad GI problems where they aren't properly digesting food. For example, gastroesophageal reflux disease can contribute to a bad odor in your mouth. Finally, people that have diabetes can also have bad breath due to the ketones emitted from the mouth. So now that you know some of the causes, how can you start treating bad breath today? Well, remember that at its core, odor-emitting bacteria is one of the major reasons you're having bad breath. So it goes without saying that proper oral hygiene, like brushing and flossing in the morning and at night, and just keeping your mouth really healthy, will reduce the amount of bacteria in your mouth and give you a bit of fresher breath. But what I didn't really mention yet is how your tongue can host a lot of this bacteria. So I would definitely recommend, for those of you out there that aren't really finding a solution or maybe tried everything else, to consider getting a tongue cleaner where you scrape the tongue safely from the back of the tongue all the way to the front to remove that bacteria that sits on the tongue throughout the day. This is common in some people and not so common in others, but I would definitely try it out if you're not finding a solution. There are also a lot of benefits to simply drinking a lot of water throughout the day and keeping your mouth moist, and also that water will serve as an irrigation device to remove, plaque or bacteria that sits along your gum line. And finally, chewing healthy food items like fruits and vegetables can actually help stimulate the salivary flow, which will be beneficial to reducing bad breath. Well, this was a quick educational video, and I hope it gives you guys that are struggling some solutions that will help you out. Thank you for taking the time to watch my video, and I will see you for the next one. Thanks.